Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos published in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about causes, diagnosis, and treatment of social communication disorder. In this episode, we begin the analysis of voice disorder, focusing on its nature, characteristics, types, who are affected by it, and its prevalence. When air from the lungs moves up to the windpipe and through your voice box, your vocal cords situated on either side of the voice box vibrate, producing the sound of your voice. It is a little like whistling. When you force air through your lips, they vibrate slightly and make your normal voice. This process of voice production is often referred to as phonation. When vocal cords do not vibrate normally, you may have a voice disorder. Voice disorders affect your ability to speak normally and clearly, leading to problems with pitch, volume, tone, and other qualities of your voice. They may change the quality, pitch, or loudness of your voice. Your voice can become rough, harsh, and coarse, strained, choppy, or raspy, strangled, weak, whispery, or breathy, cut in and out, uneven or shaky, often having breaks or gaps in sounds, or you may experience frequent loss of voice. Similarly, you may show sudden changes in the pitch, either too loud or too soft, too high or too low. For instance, the pitch may be inappropriate to the person's age or gender. Likewise, you may have tension or pain in your throat while speaking, or feel that your voice box is tired. You may feel a lump in your throat while swallowing, or feel pain when you touch the outside of your throat. Experts divide voice disorders into three categories: functional voice disorders, organic voice disorders, and psychogenic voice disorders. First, functional voice disorders. They consist in having no problem with the physical organs that produce vocal sounds, such as voice box, vocal cords, and lungs. However, despite they being normal, you have difficulties using them. Thus, functional voice disorders consist in having problems in using the physical organs of voice production or their proper functioning. Spasmodic dysphonia is a functional voice disorder that involves voice changes due to problems related to the brain and the nervous system. The nerve and brain problem cause the vocal cords and voice box muscles to spasm, which can make your voice tight, query, jerky, hoarse, or groaning. At times, the voice may sound normal, while at other times, the person may not be able to speak. Second, organic voice disorders. They involve physical problems with the organs of voice production, such as voice box, vocal cords, or lungs. It consists in the failure of the functioning of the organs of voice production because of physical or structural problems with them. Laryngitis is an organic voice disorder. It happens suddenly, often due to allergies or an infection in the upper respiratory tract. Laryngitis causes swelling in your vocal cords and voice box and makes the voice sound hoarse and rough. It can also make you unable to speak. It often lasts for a few weeks. Treatment is to rest the voice and drink plenty of fluids. Vocal cord and voice box paralysis is another organic voice disorder. It consists in partial or full paralysis of the vocal cord and the voice boxes caused by a viral infection that affects your vocal cord nerves, an injury to a nerve during surgery, stroke, or cancer. If the voice boxes are paralyzed in a nearly closed position, you may have noisy or difficult breathing. If they are paralyzed in an open position, you may have weak and breathy voice. Other organic voice disorders include hoarseness caused by viral infection or Parkinson's disease that makes your voice raspy or weak. Muscle tension dysphonia caused by too much stress on your vocal cord and voice box, leading to tightening of the muscles and abnormal voice. Vocal cord dysfunction caused by the inability of the vocal cords to open fully, leading to breathing problems. And vocal cord lesions, which are non-cancerous growths such as nodules, polyps, and cysts that can affect the quality of your voice. Third, psychogenic voice disorders. They develop due to emotional stress or trauma a person experiences in life. They might be the result of anxiety and depression. They can also emerge from conversion disorder, which is a mental health condition that disrupts how your brain works and causes physical symptoms such as seizures, weakness, paralysis, and reduced input from senses such as sight, sound, and the like. These symptoms are real and often the person finds it difficult to control them. Any person can develop a voice disorder. However, factors such as age and sex, lifestyle, occupation, and having certain types of diseases can make some people more susceptible to develop a voice disorder. Women over 50 years are more vulnerable to develop a voice disorder. People whose lifestyle includes smoking, drug addiction, or alcohol abuse are more prone to develop a voice disorder, as these addictions can damage the lungs, voice box, and vocal cords. Persons who are teachers, singers, telemarketers, and other people with professions that require a lot of speaking and use of voice are disposed to develop a voice disorder. People who have diseases such as Parkinson's disease, multiple sclerosis, laryngeal cancer, and the like are inclined to develop a voice disorder. 3% to 9% of the general population have a voice disorder, though only less than 1% of these people seek treatment. Teachers are by far the most at risk population. One study of nearly 1,000 teachers found that about 57% had a voice disorder. Thus, voice disorders can prevent you from communicating with others and expressing yourself. This can have a serious impact on the quality of your life. Hence, the need for understanding its causes, diagnosis, and treatment. This would be our task in the next episode. Thank you for watching this video. Stay blessed until we see you again with another video.